So Kyle and Daphne reached out to me. They found the information on the website for PCORI, which is the Patient-Centered Research Outcomes Institute. And what we had done is applied for a grant to create a vascular Ehlers-Danlos collaborative. And the collaborative works to bring all the stakeholders to the table to come up with research prioritization questions and to say what is important that we have to answer. And that group is consistent of physicians, scientists, patients who are affected by the disease, and patients advocacy organizations, which includes, Brian's challenge. And the point is that we work together to create to understand what the most important questions are so we can apply for the next set of grants and answer those questions. We started with a survey. We had 300 responses to that survey, so we're now analyzing that data. We have a meeting coming up in Seattle on July 27th, and that's going to be the stakeholders where we're all meeting. And what we should walk away, the goal of that meeting is to walk away with 6 to 10 research questions that we think are important. We're also applying for another grant that will help us put together a bigger meeting. This is a $50,000 grant that'll do a large conference in which the goal of that work is then to bring down the questions to 2 or 3 that are feasible, that we can come up with answers for, and then we apply to fund those aspects of the research to again turn around and give a quick answer as opposed to waiting for a very long time. I think it's very important to realize that as much as people have individual experiences, there are also shared elements in their experiences. I think it gives good emotional support. I think it gives us time to reach out and maybe break down the barriers that people may have when they go to the doctor. I've heard this scenario multiple times where people say, well, my doctor doesn't know this or that. And I think what I'd like to say is that, I am a physician and I wear both hats. And my part of my advocacy is to say, let's break down this discomfort and feel comfortable in building our teams that can advocate for us. So understanding what their frustrations are and what they perceive as being lacking in the healthcare system is very important for us, because it identifies these gaps, such as there's not enough education among primary care providers, for example, or emergency room providers. So that helps us say, okay, this is something we can fix, and we can come up with a readily, hopefully quick solution to address and try to fill in some of the gaps that the families experience. So I think that's very helpful. The other thing is that hopefully, as we all collaborate, we can move the science in a faster manner than it would have if we were not collaborating. So what you are doing at an individual level in your local communities is very important, and this can be replicated in other communities. One of the things that we have found in the collaborative work is exactly this theme, that there's a lot of lack of education, and so part of the discussion is how do we disseminate more information, not only from the patients owning it and knowing about their disease and educating physicians, but also how can we help other physicians recognize vascular Ehlers-Danlos when it does happen to come through the door. So I would say it's multiple levels. One is the patient advocacy group work that you guys are doing. The other level is on the patient's level. And the third level, from the collaborative, how can we, it's called disseminating information in an effective way among people who practice medicine.